Hello everyone, in this video we're going to discuss about different types of pain rating scales. So first thing first, what is a pain scale? A pain scale is a tool that doctors use to help assess the person's pain. A person usually self-reports their pain using a specially designed scale, sometimes with the help of doctor, parent or their guardian. Pain scales may be used during the admission to a hospital, during a doctor visit, during physical activity or after surgery. Doctors use a pain scale to better understand certain aspect of person's pain like pain duration, severity, type of pain. So the pain scales can also help the doctors make an accurate diagnosis, create a treatment plan and measure the effectiveness of the treatment. And the pain scales exist for the people of all ages from the newborn to seniors as well as the people with the impaired communication skills. Now, before moving on to different types of pain rating scales, first of all, we should look at what are the different types of pain. So, you can have many different types of pain. Pain is typically bucketed into one of the three categories. The one category is acute pain, in which there's a sudden pain and a specific pain that lasts for less than 6 months. For example, a pain that results from a cut. Then we have a chronic pain. And a chronic pain is such pain that goes on and it's a consistent pain and it lasts or recurs for longer than 6 months. For example, the pain due to arthritis. Then we have the third category, that is a neuropathic pain. So, what is a neuropathic pain? It is caused by the damaged peripheral nerves in the organs, arms, legs, fingers, and toes, and such pain is referred to as a neuropathic pain. Now, let's continue to the types of pain scales. So, the healthcare providers they have many types of pain scales to choose from, and these pain scales generally fall into one of the three categories that are number one, the numerical rating scales (NRS), and these basically use the numbers to rate the pain, as the numerical is telling you. Then the visual analog scales, which is also known as VAS. So in this type of pain scale, this basically asks you to select a picture that best matches your pain level. Then you have a third category, and that is the categorical scales. So in this, basically the this type of a scale primarily use words and possibly along with the numbers, colors, and locations on your body to rate your pain. Now, there is no one particular pain scale that is considered ideal or better than the other one for every situation. The scales may provide the quantitative measurement or the qualitative measurement, or they can provide both at the same time. So, the qualitative scale, for example, is like what does it feel like? So, this type of question can give us a clue of what is the cause of the pain. Then we have the quantitative scale. So, this answers the question like how bad is your pain, and this definitely helps us to know the response of the patient to the treatment over time. Now let's discuss each type of pain scale one by one. So the first here is numerical pain rating scale, or you can also call it the numerical rating pain scale. So this is basically the NPRS scale. And now this is designed for anyone who is over the age 9, and it is one of the most commonly used pain scales in healthcare. And to use it, you just say the number that best matches the level of the pain you are feeling, and you can also place a mark on the scale itself. Then here the 0 means that you have no pain, while the 10 represents the most intense pain possible. Now the next scale is a Wong-Baker Faces pain scale, and this combines both the picture and the numbers for pain rating, and it can be used in adults and children over the age 3. Now, basically, this type of scale has 6 faces and they depict the different expressions ranging from happy to extremely upset. And each is assigned a numerical rating between 0, which means smiling, and 10, which means crying. And to use it, you can point to the picture that best represents the degree and intensity of your pain. Now, our next type of pain scale is a flag pain scale, and this is basically a behavioral pain scale used for the nonverbal or the pre-verbal patients who are unable to self-report their level of pain. So, originally it was created to evaluate the young children, and now it can also be used for anyone who cannot communicate. So, FLACC stands for F means the facial expression, L means the leg tension or relaxation, A means activity, that is still or squirming with pain. Then C for crying, and then another C for consolability. It means that whether you can be comforted. 0 to 2 points are assigned for each of the 5 categories. Then the overall score is tallied. So scores are interpreted as follows. If the total score is 0, then it means that the patient is relaxed and comfortable. If it is between 1 to 3, it means mild discomfort. If it is 4 to 6, then it means moderate pain. Then if it is 7 to 10, it means severe discomfort or pain. By recording the flag score on a regular basis, healthcare providers can gain some sense of whether someone's pain is increasing, decreasing, or staying the same. Next, we have the CRIES pain scale, and the CRIES pain scale assesses crying, oxygenation, vital signs, facial expression, and the sleeplessness. It's often used for the babies 6 months and younger, and it's widely used in the neonatal intensive care units. Then, this assessment tool is based on the healthcare provider's observations and objective measurements, and in each category, a rating of the 0 means you are showing no signs of pain, and the rating of the 2 means you are showing the signs of extreme pain. Now, our next scale is comfort pain scale, and this is another pain scale designed for people who can't describe or rate their pain, such as children, adults with cognitive impairments, adults who are temporarily impaired by medication or illness, and the people who are sedated in an intensive care unit or operating room. The comfort scale provides a pain rating between the 9 and 45, and this is based on 9 different parameters, and each is rated from 1 to 5. So first of all, we have alertness, and here the 1 means deep sleep, 2 for the light sleep, 3 for drowsiness, 4 for alertness, and the 5 for high alertness. Then we have the calmness, and here the 1 for complete calmness, and the higher ratings for the increased anxiety and agitation. Then we have the respiratory distress, and it shows that how much your breathing indicates the pain, with the higher ratings for the agitated breathing. Then the crying, so 1 for no crying, higher scores for the moaning, sobbing, and screaming. Then in the physical movement, you have 0 for no movement, so that shows a sign of less pain. And if it is 1 or 2, so it shows for some movement, or the higher scores for the vigorous movement, for example, thrashing in the pain. Then the muscle tone, a score of 3 for normal, and lower scores for the diminished muscle tone, and the higher scores for the rigid muscles. Then we have the facial tension, and here the 1 means completely normal, relaxed face, and the higher scoring means the signs of strain. Then blood pressure and heart rate, so they are rated according to your baseline, and in which 1 means they are below baseline, abnormally low, and the 2 means baseline. Then the higher scores are for the elevated or abnormally high levels. Now the next pain scale is Miguel Pain Questionnaire, and this is also known as Miguel Pain Index. It consists of 78 words that describe pain. You rate your own pain by marking the words that best match your feelings. Some examples of the words used are tugging, terrifying, cold, sharp, and ratchet. Once you have made your selections, the provider figures out the numerical score with the maximum rating of 78 based on how many words you marked. Now, this pain scale is helpful for adults and children who can read. Now, the next pain scale is Color Analog Pain Scale, which is also known as CAS, and this uses colors to represent the different levels of pain on a pain scale. For example, as shown in the figure, you can see the red, and red shows severe pain, and the purple, or if there is another, as you know that the color different pain scales that represent the color, they can have the different colors in them as well. For example, they can be in the red, yellow, green color, and in this figure you can see the red, purple, and the blue color. So the red anywhere will show the severe pain. If it is purple or yellow, this would indicate the moderate pain, and if it is blue or green, so this would show that the person is comfortable. The colors are usually positioned in a line with corresponding numbers or words that describe your pain, and this is often used for children and is considered reliable. Now our next pain scale is Minkowski pain scale, and this uses numbers and specific descriptions of the pain to ensure your healthcare provider understands your pain. And descriptions are detailed. They include the phrases such as very minor annoyance, occasional minor twinges, or cannot be ignored for more than 30 minutes. And after reading the descriptions, you can tell the provider which number best fits your pain level. Now, our next pain scale is Brief Pain Inventory, which is a BPI. And this is basically a worksheet that is made up of 15 questions. And you are asked to numerically rate the effect of your pain in categories such as how you relate with other people, how well you can walk, how you have slept over the last 24 hours. And this pain scale captures more nuance in terms of how your pain is affecting your day to day life. Now, our next pain scale is Descriptor Differential Scale of Pain Intensity. And this pain scale has 12 lines, each of which has a descriptor such as faint, strong, intense, and very intense. And it is placed in the middle of it. Then each line has a minus sign at the start and a plus sign at the end. First, you find the line with a descriptor that best matches your pain. And then for the less intense pain, you mark somewhere on the minus side, and for the more intense pain, you mark somewhere on the plus side. Now, our last type of pain rating scale is Defense and Veterans Pain Rating Scale. The United States Department of Defense in 2021 announced it was using a new pain scale called the Defense and Veterans Pain Rating Scale, that is the DVPRS. And according to the news release, it's the response to dissatisfaction with the other pain scales from both the healthcare providers and the patients. Now, rather than a simple scale, it includes phases. Expressions range from the smiling to the high distress. Then colors, so the green for no pain, then moving through the spectrum to red, which means the worst possible pain. Then it also includes the numbers. So the 0 means no pain and 10 for the worst possible pain. Then it also has descriptors, and these descriptors include hardly noticed pain or hard to ignore, avoid the usual activities, can't bear the pain, or unable to do anything. So combining aspects of many other pain scales, this may give your healthcare provider many information to work from. And alright guys, that was all about the pain reading skills, and let me just summarize it in few sentences. That is, the pain skills can help the healthcare providers determine how much pain you are in and its impact on you. The medical community uses several kinds of pain reading skills. Some use colors, some use pictures, and others use the numbers, words, and some can use the combinations of the all of these. All right, so the provider can choose which scale to use based on your ability to read and communicate and what they want to learn from it. So all right guys, I hope you learned something from this video. I hope you found this video very informative, and thanks for watching.